Hello, everybody. So I've got some great news for you. I'm the last speaker. So your day is just about to get a whole lot better. I'm the only thing standing between you and the break. But my topic, hopefully, is going to be interesting and hopefully engaging. But I've been sitting in the audience, and I want you to indulge me, if you don't mind. Can we all just stand up? Just bear with me. I know. It's American mentality. Just stand up. Let's do just kind of like a little bit of a stretching exercise. You guys have been here for 2-3 hours. You're exhausted, I'm sure. We'll get to the coffee break, move around, talk to the person next to you, shake their hand, hit them if you want, whatever, whatever works. Okay, all right, thank you very much. And a round of applause to you. Okay, so the topic, is working, let's see. There we go. All right. So as mentioned, my name is Fadi Hindi. I'm the general manager for Olive. We're an automation company startup out of the United States. I'd be more than happy to talk to you about what we do during the break. I'm actually here to talk about a subject that's very close and near to our hearts at Olive, which is the great burnout of frontline workers as a result of this pandemic that we all are just coming out of, hopefully. So our hypothesis is that we are in the midst of one of the greatest burnouts of frontline workers. This is being like doctors, nurses, receptionists, call center, you name it, administrators of all time, we believe, or let's say in recent history. And this is a result of not necessarily the pandemic and only the pandemic, but actually the administrative burden that's levied on people that are in healthcare as a result of broken systems and bad processes and inefficiencies. And we've seen this firsthand. Olive has been around since 2014, and we know what's happening to these frontline workers. And our mission is to actually help these frontline workers get their job done better. Now, the estimated cost of this burden on healthcare is in billions of dollars. It reaches $1 trillion in the United States. Just out of curiosity, anybody can venture to say what it would be in the Middle East? Roughly, I know not all of you are from the Middle East region. It's probably about 100 billion to 200 billion. The data is, it's very difficult sometimes to forecast, but to give you an idea, 30% of healthcare on average is waste across the world. It's wasted money that could actually be put to good use if the systems were connected, if things were automated, and if we can leverage technologies like artificial intelligence to help our frontline workers get their job done faster, right? Now, the problem is not technology, and I actually have some interesting statistics to share with you about technology, because everybody blames the technology, right? Any space fans here, like avid space fans, Apollo program, Gemini program? None? Oh, a couple, all right. So you guys know about the Apollo program, where we went to the moon and we landed on the moon and we came back. So the computer for the Apollo program, you're gonna like this analogy. The computer for the Apollo program was 1 cubic foot. So it's 30 centimeters by 30 centimeters by 30 centimeters. So it's just 1 cube. And anybody wanna guess what was the weight of that? 32 kilograms for that 1 cube. And it did 12,254 operations per second. That's the geek in me now, the engineer. We call it flops. 12,254 operations per second to get us to the moon, guidance, radar, you name it, and comms, and get us back in the late 60s, right? Now, fast forward to today. I'm trying to make a point here. Fast forward to today, the iPhone 13 mini does 760 billion operations per second, and it's 0.23% the size of the Apollo computers. 0.23%. It weighs 118 grams. And I'm not talking about the desktop for the doctor or the nurse or I'm talking about their phone and the mini version of their phone. So what's the problem? If that's the case, why are we having this problem in healthcare? Why can't we seem to be able to fix this problem? Our own research at Olive, by the way, Olive is in 1,000 hospitals in the United States, and we serve hundreds and thousands of users across data centers. But our research shows that 95% of patients provide data to the healthcare provider more than twice, usually, in a particular visit. How can that be, right? When you come into God forbid, the ER, or you go visit the doctor, the information is asked of you, and then you have to provide that information again. And how can this be in this age that we're living in today, right? And then once that information is provided, that clipboard, don't you just hate that clipboard? You go to your doctor, and every time you go, it's the same clipboard. Guys, I've been here 3 times. Why are you asking me for the clipboard again? You have to fill out the information on the clipboard. And then the headache starts. This is where the burnout starts. The receptionist has to enter that data into the computer, and the nurse, God knows what she needs to do, and the doctor, and all this waste about your information. With all this technology that we have, we're still having to do this manual clipboard, information entry. And then I used to be a chief executive, CEO for an insurance company, one of the largest insurers in the UAE. And I know you guys hate us when you go to the doctor's offices because you have to get the authorization. And God forbid you have to sit and wait for the authorization while you're there. And you're constantly calling, and they're saying, oh, yeah, we just called your TPA. We're trying to get the authorization for your x-ray or whatever. You just have to sit there. That's all waste, right? How can that be again? I mean, there's got to be a better way. There's got to be a better way for us to live our lives. And we at Olive believe that the problem in healthcare is not a technical problem. It's a human problem, right? And the burnout of humans, of people, and that's where the walkout in the United States happened of a lot of healthcare workers and frontline workers, because they didn't want to put up with it anymore. I see a smile over here. I see a big smile over here. I think it's resonating with her. She's liking what she's hearing, and I'm hoping that she's probably things that you're experiencing on a day-to-day basis. So alleviating that burnout and getting the healthcare workers the help and the information that they need can make them focus on the thing that really matters, which is the patient. That's why you're there. You're there to get treated. You're there to get treatment. Instead of 40-60% of the time going to data entry and moving data between systems, they can actually focus on treating you and giving you the care that you deserve. Why can't the patient be recognized the minute they walk into the doctor's office? I know about privacy, et cetera. Just bear with me. The minute they walk in, their phone has a GPS geolocation sensor on it. We'd be able to know that patient, given that they've authorized us. We don't need any information. We can get all the data for that patient from the minute they walk in, because we can pull up the record based on their phone. I mean, this is honestly, it's not rocket science. The technology is there, but instead we receive that clipboard. And we believe that, again, another hypothesis at Olive is that the Internet of healthcare is missing from healthcare. There is no internet in healthcare. There's a bunch of siloed systems. We're talking about finance, supply chain, pharmacy, clinical systems. They are all disconnected, and this is where this waste, just mega waste is happening across the healthcare system and even into the payers, the insurance companies. So we're saying is that there is a better way. We can take a holistic approach. Our belief is that taking a holistic approach to eliminate these redundancies, the error-prone tasks, automating this end-to-end. I'm not saying anything that is that doesn't make sense, but you tell me why in 2022 we're still talking about the same problem and we have these disconnected systems. If what I'm saying makes sense, why has this problem not been solved? And until now, the healthcare industry is dealing with this. So we have to look at, we really advocate looking at artificial intelligence and machine learning and all these technologies in a holistic way, and it starts at the top, obviously. We have to make sure that the healthcare system, the payers, look at this problem and try to solve it from addressing the root causes. And incremental improvements, by the way, are not going to help. the project portfolio that begins at the beginning of the year, let's try this here and try this there and so on and so forth, that's not enough. It's not enough. It's really got to be a much, much bigger, bold vision that we say, aspiring for a new world, and the needed shift is seismic and existential for humans. And I mean by that for doctors and nurses and so on, so that we can eliminate this burnout, or we can reduce this burnout, and then get back to the thing that really matters, which is patient care. So we got to take a look at this big, bold vision, right? Now, there is something that's stopping this from happening. So you say, all right, sounds good, yeah. You talk about the iPhone mini and et cetera, so that sounds great, but why isn't it happening? What's stopping us from doing it? And believe it or not, people are stopping this from happening because they're afraid of what the technology will do to their job. The minute you say artificial intelligence and machine learning, they're like, okay, this is the Terminator, they're gonna come take my job, and that's just the typical response. And I'm gonna finish early, by the way, so you guys can get to your break or move on to the next session. I'm more than happy to answer any of your questions. I'm an engineer at heart. I was an artificial intelligence Mars Mission Research Lab guy in North Carolina State University in the early 90s. And I made it all the way to the other side, the dark side. I became a chief executive of an organization, did my own startup, and then joined all of. I've seen this problem across the entire spectrum. I know it from the digital bits all the way through to the business side. And it's really been and I say this humbly, it's just been really interesting to see the two sides of this problem. And the fact that it is solvable. It is a solvable problem, but the human side of it, where people are afraid of this change and they resist the change, and they just need to understand that artificial intelligence and machine learning and automation is not here to take their jobs. It's actually there to help them get their job done better and faster. And obviously, this starts at the top because, again, as a senior leadership, it's important that the right approach is taken. If we're bringing in advanced technologies to replace people, we're getting off on the wrong foot. I mean, immediately, right then and there. If it's a cost reduction by eliminating jobs, that's the wrong way to think about AI and machine learning. It's actually more about how can we get more done with the same people that we have. You've got the right mindset there. So educating the workforce, bring them along the journey, and then taking on these smaller tasks. We talked about incremental improvements are not going to help, but if you do a big vision of trying to fix this end to end, you can take these incremental steps, but towards a much bigger purpose. It actually will make people believe that this can help them and make their lives better. One of the big things that we were really big on is offering an AI coworker. It is basically a platform. It's actually offered for free from Olive. It can be downloaded and used, developed on, and it speeds up the administrivia that happens at the reception, at the nurse's desk and the doctor's desk, and we believe that this is a way that we can make the world better. I'm done. Good? Okay, I can take 2 or 3 questions. Yes?
Thank you for addressing the burnout. I think I wanted to just ask you if you have done any research about how much is actually will be the impact of this AI to reduction of the burnout, and how much is this irritation to the clinical people actually is impacting or resulting into the burnout. Because I think as a medical person, it seems like AI gives like a 50% kind of reduction for all the problem of the healthcare. So I just want to really see if we have a data that we can really refer on.
Yep. So it's a very good question. The question was, do you have data that could actually give us ironclad proof that AI can help frontline workers, medical professionals? And the answer is yes. In the United States right now, Olive collects about 2 terabytes of data per day. I think we have over 1 or 2 petabytes of data, obviously under all the non-disclosures and privacy statements, all within control. But what this is giving us is that we can turn this around very quickly, and we provide the analytics to our customers in real time to show them for all of the processes that they've automated and all of the all of the things that we've eliminated, how many times is it running and how much is it saving them? And they can see it actually in real life for the deployment of a particular process automation. Does that make sense? So no? It's okay.
I just want to know if by doing this, how much you discounted or reduced already the burnout. If you have a number of ex-staff that showed this result.
Yeah, I mean, I don't have one across all the 1,000 hospitals, but we've got statistics that talk about the call centers reducing 1 to 2 minutes per call as a result of having faster access to information. And people realize the interesting transformation in people, when they actually see this thing helping them, they want more of it, right? So I don't have a statistic across all the 1,000 hospitals, but give me your card. I'll be more than happy to go look that up, because all Olive's data is available in a knowledge graph and an ontology, and it's just a question that we can ask Olive and she'll respond.
One more question.
One more question.
Last one.
Thank you for a wonderful presentation. So just looking at UK, I think they're trying to sort of change the clinical pathways, both with top-down as well as bottom-up approaches. One of the challenges with AI that we see there is that the data does not represent ground truth in clinical practice. So, you might have terabytes of data, but this is fragmented and doesn't represent the problem in its holistic sense, end to end. So data in, wrong data in, wrong diagnosis in, and therefore the wrong iteration to the clinician, right? So would you agree that if we don't see the problem in its entirety, then we can't solve the problem in a holistic way?
I do agree. And we're right now entering 5 markets globally. The United Kingdom is one of them, and we're looking at working with some of the trusts in the United Kingdom around data and analytics and solving some of these problems. And the answer to your question is it's in the methodology. You gotta look at that data, and there's no way out. People try to avoid it or augmenting the data and closing the data gaps. There is no way, man. You're gonna have to sit down, figure out where the problems are, and you're gonna have to bridge that missing data, somehow close that gap in order for your machine learning models to work. If anybody tells you any differently, they're lying. It's not gonna work. So the reality is it's hard work and it's mundane, for the data scientist, but we've also cracked that problem. So now, the last set of algorithms that we were looking at I was working with Stanford when I was in the insurance company with 100 data points. All they need is 100 data points. They don't need 1 million data points. With 100 data points, we can get a machine learning model that's about 80 to 85% accurate. So we don't need gobs of data. You just need a good string of data and maybe 200-300 data points, and you can build a decent machine learning model that can predict whatever it is that you're trying to solve. Okay? Thank you very much.
Actually, I want to say something regarding that. This is for me the first time that we're like a medicine doctor with tech doctor together in one conference, which is like amazing.
Very good.
I see different view of points when we talk about AI and healthcare. So when we are like as tech people, we said that AI can help and the technology is there. But when we hear about the vision or the medicine people said, well, it's not trusted yet. So I think one example for that is the pandemic, when it comes that we have to trust what we have so far. Otherwise, we will stuck. Doctors did work during the pandemic because of the technology. The technology didn't exist when the pandemic happened. It exists before that. But we utilize it, we use it to help the situation. So I think trust is one key problem that we see between the both words, between medicine and tech people. I do have an application that's called In Harmony. I did it during my PhD, and I have it there. No one uses it. It's Address the Burnout, and where AI can identify your emotions and goes through the process from the stages of the burnout and provide recommendations to prevent your to become the last stage of the burnout. It's helped the company and the person himself. I couldn't do anything with this application. People from different industry came to me, from business, from ads. They want to use this application, not for medicine. And they said, forget about medicine. You will stuck forever because you need to do trials, you need to do a lot of testing, and this will take 10 years or so. So to go to the market today, you need to do something else rather than medicine. So that's how we see it from our perspective. It will take time, but if we shorten the process, if we trust each other, AI cannot work without the knowledge that the doctors can provide tech people. We cannot bring algorithms that can deal with problems that medicine know better than us. So we need to work together in order to find a better solutions that really works, because if we work by ourselves, the problem will be still not 100% accurate.
I agree.
I always tell the example of Facebook. Did anyone ask people who made a Facebook, how about your data? Is it secure enough? Is it this and that? That the same thing we got when we do any healthcare application. No, they were like, oh, go ahead and start the application. And the problem is there. They got it after like 5 years or so. And guess what? They didn't do anything about it. They fix it once they face it. So let's do it. Let's do the applications. Let's do healthcare. And we, step by step, become better and better. Thank
Hear,
you.
hear.